Okay, I'm gonna wait just a minute for people to start to enter the Zoom. That's happening right now. Uh, I'll just begin by introducing myself. My name's Dan Fagan. I'm a professor of science journalism at New York University and the director of the Science, Health, and Environmental Reporting program, and also the science communication workshops here at NYU. And it is a real pleasure to welcome you to the third of our four Kavli conversations that we planned for this fall. As always, we're very grateful to the Kavli Foundation for their support of this series. And I'll leave it to Apoorva to formally introduce our guests, but I'll just say how grateful I am both to Helen Branswell and to Rich Besser for joining us. I've admired Helen's work for many, many years. And Rich, of course, is such an important figure in public health in this country, as well as in health communication. And now, as the head of the Robert Wood Johnson Foundation, he's made a real commitment to supporting science communication as part of his foundation's broader commitment to these issues. And that has included some help for us here at NYU. So Rich, we're very grateful for that. Thank you very much. So for those of you now, I see the room is filling well. We're using Zoom webinar, obviously. If you have questions, and we really hope you'll ask lots of questions, please use that Q&A box that you see at the bottom of your Zoom screen. The chat isn't, you can type on the chat and we'll see it, but your fellow audience members won't. And it's really the much better way to ask questions, and Apoorva will look for them, is using that Q&A box. So please do that. It's a pleasure and an honor, really, to introduce our moderator today. She is a former student of mine who has done such extraordinarily great work over the years, especially lately, but not only lately. Since May, Apoorva Mandavilli has been a full-time staff reporter for the New York Times, focusing on science and global health. And of course, that means coronavirus 24/7 for now. But she's been doing great work on a broad variety of topics for a very long time. In fact, last year she won what's really the top prize in medical journalism, the Victor Cohn Prize. Before she was at the Times, she was the founding editor-in-chief of Spectrum, which is a terrific news site on autism science. Before that, she was at Nature Medicine. And before that, I happen to know she was at the New Rochelle newspaper in Westchester County, which was the first place she worked after she was at the SHARE program at NYU. Apoorva has been published all over, The Atlantic, Slate, New Yorker Online, a lot of other places. And I just want to mention too, another thing I admire about Apoorva, that she's committed to building diversity in our field and doesn't just talk the talk, she walks the walk too. So Apoorva, take it away.
Thanks very much for that incredibly generous introduction, Dan. I'm going to have to talk to you about that honored part later. But I would like to introduce our two distinguished guests, and I'm really looking forward to this conversation because these are two of the people who I think know more about what's been going on in this pandemic, but also how to think about it in a very broad way. I'd like to start by introducing Rich Besser. He is the former, one second, sorry. He's the president and CEO of the Robert Wood Johnson Foundation, a position he assumed in April 27, and he's ABC News' former chief health and medical editor. In his role at ABC News, he provided medical analysis and reports for all ABC News programs and platforms, traveling all over the US and around the globe to cover major medical news stories, including Ebola in Liberia in 2014. But before joining ABC News in 2009, he worked as director of the Coordinating Office for Terrorism Preparedness and Emergency Response at the CDC. In that role, he was responsible for all of the CDC's public health emergency preparedness and emergency response activities. And he also served as acting director of the CDC from January to June 2009, during which time he led the CDC's response to the H1N1 influenza pandemic. So he's a unique person with a perspective both as a journalist and as a public health official to talk to us about this. And Helen Branswell, when I asked her for a bio, said to make hers shorter than it is on the STAT website, but I'm actually going to break all the cardinal rules of journalism and make it longer. Helen is STAT's infectious diseases and global health reporter. No doubt you've read her work if you've read anything about the pandemic. She came to STAT in 2015 with 15 years of experience covering health with a focus on infectious diseases. She was introduced to epidemic reporting during Toronto's SARS outbreak in 2003. And in the years since, she has written about bird flu, the H1N1 flu pandemic, Ebola, Zika, and now leads STAT's coverage of the coronavirus pandemic. She spent the summer of 2004 embedded at the US CDC as a CDC Knight Fellow. And in 2010-2011, she was a Neiman Global Health Fellow at Harvard, where she focused on polio eradication. And Helen is also one of the first people to recognize that this was going to be a pandemic. She'll probably never forget that in February, she and I were having Twitter DMs where I was still not really sure that this was going to be something to worry about. And Helen, meanwhile, was completely onto what was happening. She has also been described as a goddess to infectious disease experts. You really can't get it a much better praise than that. So welcome, Rich, and welcome, Helen. I'm really looking forward to this conversation.
Thank you.
Thanks so much. Great to be here.
Parva, I forgot to mention that just to avoid distracting, I'm going to go ahead and turn my screen off so no one has to look at me the whole time. So,
Okay.
But I'll be listening avidly.
So, Rich and Helen, I think you both have one thing in common that we can start right off is that you've both been in this space and infectious diseases and looking at emergencies for a very long time. And so I thought for our audience, it might be interesting to actually start before COVID and look at something that's somewhat comparable, although the scale is hugely different. Rich, you were the interim CDC director during H1N1, and Helen, you covered it. So can you both take a few minutes to sort of walk us through what did it look like when we were facing another infectious disease outbreak? What was the country like? What was the pandemic response like? And Helen, what was it like to cover it? Maybe we can start with you, Rich.
Yeah, well, back in 2009, back in one of my cameras, for some reason, I just jumped me right back there. In 2009, in April, I was the acting director of CDC, a position I didn't expect to be in at the time. When I was asked to be acting director, when Obama became president, I was told I would be in the job for about 6 weeks. And then Secretary Daschle would come on board and would name the permanent CDC director. But then his confirmation went down in flames, and I ended up being the director for longer. And when the pandemic hit, there's always at the start of something like that same sense that it sounds like you had when you were talking with Helen of, nah, this couldn't be, the sense of denial, until there's enough little pieces of information where it's clear that this is something real. And when so this was very early in the Obama administration. It was short of 100 days of the administration. And so there was a number of things unique about that. There was no real infrastructure in Health and Human Services. There was no secretary. And so as an agency, we were incredibly nimble. When we laid out our strategy from the beginning, we put communications as a central piece of this. In terms of all the normal things you do in public health and emergency response, in terms of disease surveillance, in terms of providing guidance for hospitals and doctors and businesses, we recognized that communication was a critical piece of this, that communication is the key to trust, and trust is the key to people following the recommendations that you have, especially since early on in a pandemic, what you don't know far exceeds what you do know. And so from the very outset, we started with daily briefings to the press. And we said we would stick with those and stick on the briefings as long as there were questions. that you initially start, we would only scale it up to the director when it became clear that was necessary. And so we started as center director and then worked our way up. Within a couple of days, I was doing the briefings every day because it was clear this was something that required the director to be the face of this. And what we found was it was very effective to be communicating heavily about this. You know, there's a lot I can say about that. A lot of stories about how that played out. But the value of communication is multifold. It helps establish trust with the public, but it also helps us do our job better, because the questions that journalists ask are often really hard, and they force those in government, those in public health, to challenge their assumptions and to go back and often do things they wouldn't have done otherwise. You know, in an emergency operations center, you can think of it as like being in a submarine where you're not getting a lot of input from outside this very enclosed space. And so journalists were the ones who were able to say, hey, have you thought about this? Why aren't you closing borders? Why aren't you doing this? What do you think about this? And being forced to answer those questions helps public health do a better job.
Ellen?
So from my point of view, you know, there are similarities to the way things started to unfold with COVID-19 and huge differences. Here's one. In April of 2009, I want to say about the 9th of April, but I'd have to look up the date. I was contacted by a contact of mine, somebody I dealt with for a long time at the CDC, who said, we're having a call tomorrow. You need to call in at this time, at this number. You know, it's going to be under embargo, but you need to be on this call. And when I called in, or it might have even been later this afternoon, when I called in, there was Maggie Fox, who was then with Reuters, and Mike Stobie, who was with the AP, and Dave Brown, a very good former reporter from the Post, and somebody from WebMD, I think, and myself. And people from the CDC flu division were on the call. Nancy Cox, I think, led the call. I don't know. I can't remember if you were on it or not, Rich. But effectively what they did was they explained, we are going to be announcing that we found these 2 cases of children who've been infected with a swine flu virus. They're both in California, but they have no connection to one another. And do you have any questions? And so we all went around, and finally somebody said, is the start of a pandemic? And the CDC people said, it looks like that may be what it is. We don't know yet, but it's early days. And then they had a press conference and for everybody, and then it was off to the races. And daily press conferences, as Rich said, were the norm. I remember them being on weekends. They were, just effectively whenever we needed contacts or context, we could get it, which of course is not the case with this pandemic, and has, not served the nation very well. It certainly hasn't served CDC very well. There was another similarity, and this is not sort of so CDC centric, but one of the funny things about the 2009 pandemic was it wasn't immediately clear that it was going to be severe. And in fact, as time started to go on, it seemed like it wasn't essentially super severe, but nobody knew for sure. And all of the people who had been doing flu pandemic preparedness for years had in their minds the paradigm of the 1918 flu, which had a mild spring wave followed by a very severe fall wave. And so they were all concerned that this is maybe what we were going to see. The World Health Organization had, do you remember the 6-stage pandemic declaration device or schema, whatever it was, Rich. They had worked out for years, this will be, phase 1, and then we'll go to phase 2, and then, phase 3. And once it's clear that a novel virus is circulating amongst people and transmitting effectively from person to person, it'll be stage 6 and it'll be a pandemic. And in fact, it was clear for weeks that the world was in a pandemic, and the WHO couldn't declare it because countries that had pandemic flu vaccine contracts that were going to be triggered by the declaration of a pandemic were looking at the situation saying, I don't know if I want to buy pandemic flu vaccine for this in this circumstance. It doesn't seem to be such a big deal. And there was sort of pushback to WHO to not make the declaration. And it was really, that's, you probably know more, Rich, there was probably more to it, but it was weeks before a pandemic was actually declared, even though it was clear that there was one. I was thinking about that this spring as we were sort of watching this slow, well, I was going to say slow rolling, but it wasn't slow rolling because it was moving very quickly, but people's reaction to it didn't seem to be very quick. I couldn't figure out this spring why, we got into February and into March. And it was really only in March that people started to realize, oh yes, this is a real thing, and there's no force field around China. This is coming.
Right. Yeah. We took the exact opposite approach in 2009, and we had been practicing for pandemic flu for years. It was a big emphasis during the Bush administration to flu preparedness, and so each year, Dr. Gerberding would take us through 2-day exercises in responding to the flu, and it would be day -2 before it hits, and first signal, and we would work it through so that we were ready for that. And one of the lessons of pandemic response is that when there's a new emerging threat, an infectious threat, it's not possible to know how severe it's going to be. You can't tell if it's going to be a 1918 flu or if it's going to be a mild flu year, and you only have one chance to get ahead of it. And so what we said is we are going to be very aggressive up front, and we will back off, when and if it's clear that we can do so. And if you don't take that approach, you end up where we are with this pandemic, where you underplay the severity, you give people a false sense of security, you don't lead to people changing their behavior at a time when it can have an impact. And I remember answering questions about the whole WHO thing, and why haven't they declared it a pandemic? Is it a pandemic? And explaining that really pandemics are a series of rolling local events. It's what we've seen across the country. It hit Seattle, it hit LA, it hit New York. It's going to hit everywhere, but it's not hitting everywhere at the same time. And so, who cares if WHO has called a pandemic? In the United States, we have widespread disease. It's definitely an epidemic here, so we have to do this. But there was so much focus around when are they going to make that call, and for our purposes, it was much more relevant when the U.S. government declared it a national public health emergency, because that triggered the ability to do things in the U.S.
Right.
Yeah, I think that's a really good
just
point. Oh, go ahead, Helen.
I was just going to say that, one of the huge differences, and we've touched on it a bit, is, over the years that I'm covering these kinds of things, in the lead up to the 2009 flu pandemic, there was that huge concern about bird flu that Rich alluded to. The Bush administration was really concerned, as was most of the world, that H5N1 was going to trigger a very bad pandemic. The CDC had always placed a really strong emphasis on good communications. Julie Gerberding, who he just mentioned, was one of the most gifted risk communications experts that I've ever heard in terms of addressing the public. And then she was followed by Rich, who's also extremely good at it. And then, there was Tom Frieden, who was also very good at it, and Anne Schuckett at the CDC, who's currently the deputy principal principal deputy director, who is, again, one of the most skilled people I've encountered at this kind of thing. And it's a real tragedy that her voice has been silenced in this outbreak. The American public would be far better off if Anne Schuchat were unleashed to, that's a bad word, but a bad way to phrase it, but if she were freed to do daily briefings and had been months ago.
I couldn't agree more. You know, it's developing a relationship with the public through the media that leads people to want to follow advice, and it leads people to a level of understanding when advice changes. You know, there were so many times during this response so far where the guidance changed, and rather than it being seen as a really positive thing, that as you learn, you adjust your guidance, which is what you want to see in a science-based response. It's been viewed as flip-flopping. So, like, why did CDC not recommend masks? Now they recommend masks. You know, they said it only protects other people. Now they're saying it protects you. You know, don't they know what they're doing? It's like, yeah, they know what they're doing. They're doing science, and science leads to new information, which should change what you do. But without that relationship and that daily communication, you know, with guidance just kind of appearing under the dark of night, you miss the opportunity, not only for people to understand, but for people to even know that something different is being recommended.
To be fair, though, Rich, I mean, I think part of the mistrust that people have, right, with what the messages coming out from the CDC is not being able to know what is really the CDC speaking and what is the forces behind and above the CDC speaking.
Yes.
And not having the CDC, as you pointed out, both of you pointed out, not having the CDC front and center explaining this is what this document is, this is what it means, having access to journalists to explain what that means. So paint a picture for me of, you know, all the ways in which the CDC is not able to do the things that it needs to be doing. I mean, you've talked about, you know, the importance of communication, but there's a lot more here, right? That has not gone the way that it should in a pandemic, beyond communication. So what are some of the things that are just absolutely bananas about the way public health has unfolded during this pandemic?
Wow. Yeah, broad question.
Much.
I think so much.
Top three
yeah.
things.
I think 1, 2, and 3 are communications, because when you look at what CDC's been called out about, I ran emergency preparedness and response for 4 years. I started on the day Katrina hit New Orleans, and then segued into the role as acting director, and so I ended my career with H1N1. And in every response I was involved in, you make mistakes. You know, some are that you try things and they don't work, and others are you truly make a mistake, you do something wrong. But if you have a relationship and you're in communication every day, it doesn't destroy the relationship and the faith in what you're doing. Here, there were some real mistakes that CDC made early on around testing and developing test kits, but that played out in the media, you know, just for months and months and months. And part of it is there was no access to CDC for anything else. There was no clear access to explain and own the mistakes and what was learned from that. And so it really undercut the relationship and allowed political leaders who didn't want to be led by public health anyway. It allowed them to say, why should we listen to CDC when this is what's happening? One of the things that really marked the response to the flu pandemic in 2009, I remember going to the White House to brief the president and the cabinet. And this was the 100th day of the administration. And it was the first day there was a full cabinet there. Kathleen Sebelius had just been confirmed as HHS secretary. And I gave my briefing, and the briefing I gave them was exactly the same briefing that I give to the media. One of the problems that people in science often do is they brief political leaders like they're technical experts. but political leaders, they're not. They're like your neighbors. The only one who worried me was the energy secretary who had Nobel Prize in physics. But the rest of the cabinet, they're like your neighbors. And I finished my briefing, and the president looked to the cabinet and said that you all have a role in this, and everything we do is going to be driven by the best public health science. And the next day, when the president did his radio address, he repeated almost word for word the briefing and recommendations that I had given the cabinet. And when I came back to CDC, to the Emergency Operations Center, and I said that the president had said this is going to be driven by the best public health science, there were cheers that went up. And that's what you need to see. You need to have it doesn't mean that every decision is the one that science would make, because there are policy nuances that have to play out. And there were a number of times where we made mistakes at CDC because we didn't have this policy layer above us. But you want to make sure that any of the policy decisions are informed by science, and it's clear where you're making a decision based on science and when science is being overruled by other requirements and needs.
Let us get back to that in a second, but there's something that I want to because I know in the audience there are a lot of journalists, and having covered a few of these things, I remember observing this first during the SARS-1 outbreak in 2003. Things would change and everybody get really upset about, you told us one thing last week and now you're telling us another thing. That's what happens with science. A new disease is by definition something you don't know that much about and you learn about, and you adjust your approach to containing it, or your advice to people based on what you've learned. We want leaders to do that. We don't want them to sort of say fix. They have to be able to change. And I think as journalists, it's our job to try to educate the public, which doesn't have necessarily that great a concept of this, that they don't know that much right now. A week from now, they'll know more. 3 weeks from now, they'll know a ton more. But, the fact that something might change is not a nefarious thing, because some science journalists are, I think it sounds like you took this path, Apoorva. You may have always been a science journalist, but a lot of us are people who worked in general news and, covered politics, and in politics in particular, when somebody changes their story, there's, your brain goes, oh, that's different. Why is that different? And you go looking for it. Is something, is the wool being pulled over my eyes? But I think when people are reporting on science, you have to be very careful with that instinct. Sometimes it's true, the CDC's guidance that was doctored by the White House on reopening of churches. That was a case where it was really important for that instinct to kick in. Yeah. That guidance was not science-based, that guidance was politically based. But the fact that the CDC didn't initially recommend people wear masks, first of all, we need to remember that back in late February, early March, cloth masks were not a marketed thing. You can't go on an internet site right now without being shown an ad for a mask, but you couldn't buy them back then. You had to make your own or use a bandana or whatever. And there was, I'm pretty sure, Rich, tell me if I'm wrong, zero data to show that a bandana or material from a t-shirt that was strung between two elastics, zero data to show that would be effective in cutting transmission, protecting you or protecting the people around you. Especially back in the early days, a mask wasn't a mask, it was a million different things. And that they were not recommending people use them reflected the fact that they didn't have data on which to argue that they were worth using.
Just to react to that, I remember when the decision was under review as to whether to recommend masks. I serve on a committee of the National Academy of Medicine to provide rapid science reviews on topics for the government as part of the response to the pandemic. And I co-chaired the work group on assessing the scientific evidence around wearing masks. And we were asked by ASPR, which is the Assistant Secretary for Preparedness and Response in HHS, to look into the science on this. And we had a committee, we reviewed the science, and there was a fair amount of science about using masks in healthcare settings, using N95s and surgical masks, and some on using cloth masks in under-resourced settings in healthcare settings, but just about nothing on masks in communities. The laboratory data looking at cloth masks, different type of cloth masks, showed that they were not very helpful. And so, when it came to the science around it, what you're saying is spot on. There really wasn't good science. And so our finding was that there is not good science on this. And from a public health standpoint, we had worry that someone would put a bandana on, think they had protection, and then go out and act like there was nothing to worry about. And so the downside to masks was that concern. Since then, there's been a lot of data generated about the value of different types of cloth masks in community settings. And the latest assessment, which was really exciting, was that it could reduce not just the risk that you're going to infect somebody else, but it could reduce your own risk by up to 70%. The thing that struck me, though, what you were saying at the beginning about science journalists is really key. You weren't invited to that phone call at random. It wasn't a matter of CDC says, well, we've got 50 journalists, let's just go every 10th one.
Let's call this random Canadian who doesn't even work in the United States at the time.
Yeah, well, it was a recognition that science journalists are different from general journalists. And
right.
I participated in the night fellowship at CDC in all the years I was there that it existed. And it was a great program that embedded journalists in working programs to gain an understanding of public health. And it was awesome. And I worry about the loss of science journalism and the idea that anyone who's a general journalist can cover science in the way it needs to be covered. I mean, you are when Apurva was saying you're a goddess to people in infectious diseases.
Stop using that word, please.
Well, I won't use that word, but I would say that you are highly respected by people in infectious diseases because you understand infectious diseases and you don't pull your punches in asking hard questions, but you do it from an informed perspective that's really, really valuable.
Thank you very much. I would just say in the current context, everybody is a COVID reporter. Your newsroom must be full of them, Apurva, like people who were writing education and now are writing COVID. Everybody on one level or another is a COVID reporter. Science reporting is tough and it takes a long time. Of all the types of reporting that I've done, the learning curve for this job was the steepest I've ever climbed. It took not months, but years for me to feel comfortable, that I wasn't sort of going to write something really ridiculous. But I mean, I think people are really trying hard. You see people talking about the R naught and transmission dynamics and stuff. I think people are learning a ton. And I do hope and have a fair amount of confidence, actually, that this event will revitalize science journalism. Newsrooms will understand the need to have dedicated science journalists, that, you're just not safe to cut that part of your newsroom, hopefully. Anyway.
I was going to say, we've been talking about masks a lot, and I think that brings up a really interesting thing interesting in a bad way, thing that's happened over the last year, which is that science is actually being seen as partisan, and masks are part of that. So given where we are now, where everything about this pandemic has been polarized and become partisan, how do you think we will regain, the trust in public health, especially when we think about preparedness for future pandemics. And I want to sort of roll an audience question into that. Robert Lee Holtz, who's a science journalist at the Wall Street Journal, wants to know for Rich and Helen, the pandemic has been a stress test revealing flaws in public health agencies in the US and internationally. Moving forward, what 3 things would you do to ensure credibility and political independence of public health advice in the next pandemic? Rich, do you want to take that one first?
Thanks. Well, in the years I was at CDC, when I think about our response and the work that non-response work, but work in emergency preparedness and response, an overarching objective was to make it nonpartisan. The response had to be national, and the support for emergency preparedness and response had to be bipartisan. And I learned really to code switch when I went to Capitol Hill and how to talk about the work of public health to different audiences in ways that resonated. This was a time where there was a lot of concern about anthrax and bioterrorism attacks. And I knew that resonated pretty strongly with conservatives on Capitol Hill. And so talking about the need to be able to do basic public health functions of surveillance and communication and having laboratory networks, those kinds of things, being prepared, having a stockpile with what was required to be able to respond. That resonated very well on the conservative side. And then talking to people on the more liberal side about the need for public health, because public health is that part of health and human services that is looking at populations and how do you improve populations. And if you can't do surveillance to understand diseases in your communities, you're not going to be able to address them. If you can't do studies to understand risk factors, you're never going to be able to craft programs to address that. If you can't communicate. So it's the same tools, but being talked about in a different way. And there was pretty strong support during those years for public health infrastructure at the federal, state, and local level. I was in charge of a budget of about $2 billion, and about $1 billion of that went out to states and locals for preparedness and for infrastructure. We've seen a major disinvestment in our public health infrastructure at all levels. Trust for America's Health, they estimate, I think somewhere in the order of 40, 50,000 public health workers are no longer in the workforce. And so we need a long-term commitment to supporting public health. What happened after Katrina was this big flurry of we can never let this happen again. And then within 2 years, there's absolutely no interest in making the kind of transformational changes that you need to make. I participated in a work group for the Council on Foreign Relations, and it's all about preparing for the next pandemic. And one of the things that we submitted from the foundation as an addition to that report is if we truly want to be ready for the next pandemic, we have to look at what other nations provide their citizens in terms of basic needs. And if we want to be ready for the next pandemic and we want everyone in America to have a fair and just opportunity to protect their health, the health of their families, and their health of the communities. If we want in the next pandemic to not see death rates 3, 4, 5 times higher among Black, Latino, and Native Americans, we need universal health care. We need jobs that pay a living wage. We need everyone to have sick leave and medical leave. We need to have protection from eviction and foreclosure. These things are part of public health. And we need the public health community to say, yes, this is something we need to care about, because whenever a public health crisis hits, it is lower income communities that are hit the hardest. It is communities that have taken the brunt of structural racism. And if we don't work to change those things, then we are going to see every pandemic in the future play out like this one in very unfair ways.
Well, and I want to hear what you have to say about this, but Rich, I just want to add on this question since you started talking about the funding Mark Gentile wants to know, on top of miscommunication, would you say that the lack of funding in the Public Health Emergency Fund, only $30 million, played a large role in our failed response to the pandemic? And can you speak on the lack of funding towards the PHE?
You know, I look to journalists to dive into that story and see what the impact was. That's something where journalists can play a really important role. It's very hard to know exactly how that played out. You know, the CDC Foundation plays a role in terms of collecting resources and moving money quickly to places where it may be needed during a crisis. You know, we provide some resources to the CDC Foundation for that. But if there were an emergency response fund that the agency could tap into, and that would be a terrific thing. CDC, you know, until I became acting director, I had no idea how little discretionary funds the agency has. It's something worth looking into. How much flexibility does the CDC director have around spending money? It's very different from NIH in that regard, but just about every dollar that CDC gets is pegged to a particular issue. And the times when CDC has tapped into pots of money that have been earmarked for something else and used it, they have suffered dearly.
Helen?
I'm sorry. You cut out there for a second.
To add to the original question.
Oh, the top three things.
How do you restore faith in public health institutions and prepare for the next pandemic?
Yeah, I don't know that as a reporter. It's my job to be advising on that, and I'm not certain I'm the best person to even opine on it.
How would you, as a journalist, let me reframe the question for you.
Okay.
What would you, as a journalist, take as a sign that the public health agencies are functioning the way they should and that you don't have to poke around as deeply as you might otherwise?
I think it would be really good news to hear that the CDC's website could not be rewritten by people in Washington who had the power to post and update the site without even clearing it in Atlanta. I think that would be really important news. Some of the problems that the agency has run into in the recent months with guidance that looked more like something that was a party platform as opposed to public health science, that some of that stuff I think went up live before people in the CDC even knew it was happening. That's just kind of horrifying.
My understanding is that they did know that it was happening. They just were not heard on their complaints.
Well, I know that there were times when they were overruled, but I do think that there was at least one time where it was changed and found out after the fact. I might be wrong. Anyway, having the White House write, policy that is meant to be science-based is not a good idea.
Okay. We have many questions already. We have one question that I'm a little confused by, so I'm going to ask the two of you. She says, can you please, this is Carol Perelman. She says, can you please discuss if we should shift our mindset in the definition we are giving to SARS-CoV-2? Shouldn't it be more like Bio 3 plus probably a Bio 4 level pathogen? Most response in Western world is treating it like a 2 influenza-like virus.
It is a level 3 pathogen, is it not?
That's what I thought it was.
Yeah, I'm pretty sure it is.
Yeah.
In fact, I think that actually causes some
serious problems.
Difficulties for researchers. Yeah.
Okay. All right. So we're moving past that one. This is, I think, a question that we can all really relate to in terms, especially right now when we're, faced again with yet another wave. But Lynn Carroll wants to know, like many people, I anxiously scoured news for COVID information in March, April, and May, but then had to stop for the sake of my sanity. Now I'm anxiously scouring again, a boom and bust cycle that follows the case graph. How can we Americans learn to consume a healthy diet of COVID info enough to be safe, but not so much that we freak out?
I don't know, but if somebody figures it out, would they please tell me?
Yeah. I mean, yeah, one of the things I do is I turn the TV off. It's really, for me, it's really interesting having worked in different fields. The years I spent at ABC News, I had the news on constantly. And so, during a crisis like Ebola, I was on the news all the time, but I had the news on all the time. And I think it kept my level of stress and vigilance at this really, really high level all the time. That was very unhealthy. And during this crisis, even though I'm doing a lot of media to try and talk about the pandemic because CDC can't. When I'm not, I don't have it on at all. It's kind of the same way. It was my same approach to the election returns. I just couldn't watch TV and do that. And I think it is really important to disconnect the because things don't play out at that pace. And the idea that if you've missed a day, you've missed it. It's different. You're a journalist. You're a journalist covering this. But for the general public and for others, you can overconsume. And it's pretty. It's disturbing that the story I did, the segment I did most for ABC News over the 8 years that I was there, was how to talk to your children after a shooting, a mass shooting. Mm-hmm. And it was unbelievable how often I had to do that. But one of the big messages was turn off your television. Don't expose your children. And it doesn't just go for children. You can traumatize people by overexposure. And I'm on cable news maybe 2 or 3 times a day, and the half hour that I'm on, kind of listening, leading into my segment, it's not good. My stress level just goes up and up and up. It's not the explanatory journalism that I get when I dive into one of your articles, and I feel like I understand the situation in a better way. It's at a more superficial level. It's at a kind of adversarial level. It's playing it like a sports competition rather than a crisis. And so disconnecting, I think for the general public is good. And for those in journalism, avoiding the hype when you can.
Can I just add that I think that it's going to be really important to take that into consideration in the weeks going forward, because, we're still in transition and the president hasn't conceded, and there are still certainly the circus hasn't ended yet, but the circus is going to start to end, and that kind of coverage is going to dial down. I fully expect President President-elect Biden will be a much more boring president and aim to be a much more boring president. And so cable news is going to have to fill that void. And as we know, the numbers of cases in the country are just skyrocketing, 150,000 today. The dialing down of political stuff is happening at a time when the virus is amping up. And so it's going to be 24/7 virus, I think.
Yeah. The other piece of that worries me in recent coverage has been around the vaccine, the latest vaccine, the Pfizer vaccine, and the sense that it's over. We've got a vaccine, which really neglects the true science of what we truly know at this point. It's a company release, not the science. It's early days, and that kind of reporting will contribute to people feeling like they don't need to change their lives right now because it's just about to end.
Mm-hmm. Helen, I want to go to your point that you were just talking about with, how bad things are right now, and that we still have a couple more months of the circus possibly. And we have a question right along those lines. Someone in the audience wants to know, given what we've seen and what you've said today, and given that we have 2 more months of the Trump administration, how bad are things likely to get in the US before we can get a federal response?
I hesitate to put project numbers, but I mean, deaths are up. Clearly, the death rate that was seen in the spring ameliorated somewhat. Doctors seem to know more how to treat this disease and people who become severely ill. And I think, you can tell me if I'm wrong about this, but I think that it's also true cases are being seen more broadly over lots more age groups. So we're, in a situation where the death rate can seem lower because it's just more spread out. But sooner or later, you can't have this many cases without deaths rising. And hospitals all across the country are talking about being overflowing, and that has implications not just for people who have COVID, but women who need mammograms, and people who need colonoscopies, and people who whose colonoscopy finds something and they have to sort of try to figure out how to get in. I mean, the knock-on repercussions of this over the coming weeks and months is just going to be enormous. I mean, we absolutely let ourselves get into this situation, and it's going to be painful trying to get out of it.
I think that some will also depend. I agree with everything you said. It's not just the COVID mortality, but it's who else can't get into the hospital, and that's really big. When you look at the excess mortality early on in this, there are a lot of deaths from people who are having chest pain, and last place you want to go is the hospital. So how many people delayed care because of this? We did a survey with the Harvard School of Public Health and NPR looking at various factors. And what we found was a significant number of people had family members who had serious medical problems who did not get medical care, either because they were afraid to, or they couldn't get in, it wasn't available. And a significant number of those people said that it led to serious complications of their health. Much higher rates among people of color. And so, as these numbers go up, even if the death rate for people who have COVID is low, it will have big impacts in these other areas. The other part of it that I think is so critical is that if Congress doesn't act and put money in people's pockets and put in place eviction for protection and mortgage foreclosure protection, and mandate sick leave and medical leave. A lot of those things have expired already. Some expire at the end of the year. There are tens of millions of people who are at risk of losing their homes in January. So here you have a raging pandemic. The one place you want people to stay to protect their health is their home. And you have tens of millions of people who could be homeless. For the richest nation in the world, it should be absolutely unacceptable and humiliating to think that we would let that happen. But Congress has not been able to come together to do this. I had a glimmer of hope early on when the CARES Act passed, and it was almost unanimous, both sides of the aisle, and it put money in people's pockets, and that helped stimulate the economy. One thing is if you're giving money to people who are lower income, they're going to spend it. And that's what was seen, and it helped keep people in their homes and put food on the table and allow some people who thought they were sick to stay home and not have to work. These are things we could do as a society, but we're not doing. And so, there's the piece of, I hear so much being written about the personal responsibility side of wear your mask, social distance, wash your hands. And that's part of it. But the structural issues, these things that Congress should be addressing are are major and could have a big impact. And, you know, it's just politics that it's not happening.
I have a question here from a student journalist who wants to know, for student journalists or freelance journalists just starting their writing career who are interested in investigating these public health organizations about their roles, how do you get them to talk to you about these challenging conversations without rubbing them the wrong way? How should new science journalists approach these organizations? Helen, you want to take this one?
I want to hear what you would say.
Well, I would say I think that you have to build trust with your sources. I think the best way to get them to not rub them the wrong way is to get your facts right, to put them in context, to make sure that you protect them when they're anonymous, and that the stories are fair and always accurate. And that's really the best way.
Yeah, I think that's true. You know, I was writing for a Canadian news outlet, you know, Canadian Press, which is a wire service like the Associated Press, but small and not well known in the United States for sure. And over time, you know, people would answer my emails and, you know, agree to speak to me because I was writing stuff that, you know, they thought was important. I was writing about topics that they thought were important, and I think I was doing a fair job of it. And I believe that, you know, if you do good work, if you recognize when you've made an error and correct your errors and be public about correcting your errors, that's really important. You know, people will respect you and will speak to you. And even if they don't like the questions you're asking at times, you know, but you kind of have to earn it, I think.
Mm-hmm. I agree with that. And it seems like if you do that kind of work, people will seek you out. You don't even have to often go to them. They will come to you a lot of the time. So just keep plugging away at it. Question here from Marcus Banks, who's a former intern.
Just to jump in on that, from the perspective of someone who journalists have called a lot. I spent 8 years at ABC News, but I have enough respect for the field of journalism to say I am not a journalist. I was the medical editor at ABC News, but I was not a journalist. But when I was at CDC and now at the Robert Wood Johnson Foundation, a lot of journalists reached to me, and I just want to echo what you're saying. When you're called by a good journalist, someone whose work you respect, you really want to talk to them because you want to make sure they're covering the issues you think are really important. And that's something you can contribute, not only your perspective, but you can help steer people towards a story that you think is either not being hit or isn't being hit right. And there are a number of journalists who over the years have followed up with me after they've done a story and just asked my opinion. And another thing I learned at CDC from our media people was when someone gets it right, it doesn't hurt to just send them a note saying thanks for such a good story. And it's not that it wasn't honest journalism. It's like thanking them for doing really good journalism. That can be really helpful. And it also can open the door when someone doesn't get it quite right to say, hey, in that piece, I think you missed something here or got that nuance wrong, and people will be open to it in a good way.
Well, hopefully a good journalist is always open to that, even if they haven't had a long relationship with you.
I agree, but I do know that having worked in a lot of newsrooms, some people are very touchy about having made mistakes, and I would urge all the young journalists in the audience to understand that you're not going to get it right all the time, and people are doing you a favor when they point out to you that you've made a mistake. I mean, sometimes it's somebody who doesn't like, who sees things a different way, and it's not wrong. It's just they don't like the way it makes them look or something like that. But if you've actually made an error, you want to get that fixed. You want to take it down. Errors beget errors. I always say to people, like, if you see anything wrong with my story, tell me as soon as possible, because I want to get it off the website, because the longer it's up there, the more chance there is somebody else is going to read it, plants in their brain this false piece of information. You just want to address that stuff as quickly as possible.
This next question that I wanted to ask isn't so much about errors, but I think a lot of journalists struggle with this, the false equivalence kind of stuff. And this particular thing really brought that up. This question's from Marcus Banks. Hi, Marcus. Now that some form of vaccine seems likelier than it was just weeks ago, is there less risk that herd immunity strategies, as in the Great Barrington Declaration, will carry the day? Or is that risk always with us?
I don't think it will carry the day with the next administration, but I worry over these next 70 days that there's not going to be much of a federal effort to help people do the things they want. It's one of the messages I've been pushing is that there is a lot that governors can do. The governor of Utah a couple of days ago put in a mask mandate, a very red state. There's a lot that can be done at the state level. There's the one thing that a lot of people don't realize is that CDC has very few authorities. CDC can influence, but apart from its quarantine function, its protection of boats and things coming in, there's very little that CDC could not impose a national mask mandate, but states can. And so seeing more states get on board with following the public health recommendations, seeing political leaders from both parties. I mean, it'd be wonderful to see them coming together and jointly, making statements and PSAs saying, hey, we don't agree on our politics, but we sure agree on this. Wear your mask. There's, to try and take some of that out of it, because it's going to be a real challenge. There's going to be a change of administration, but the virus doesn't care who's in. And if you can't get people to make these changes, then that the Great Barrington approach is de facto what we'll be doing until there's a vaccine, because people, if 30% of people aren't wearing masks and social distancing, it's enough to really do a lot of damage.
Yeah, that's my concern. It's not so much, I mean, I think most people don't have a clue what the Great Barrington Declaration is about, or even maybe don't even know who Scott Atlas is, the White House advisor du jour. But, what my concern is that it has become very baked in the States. It's been a loyalty test for a long time now. Our side doesn't wear masks, our side does wear masks, and I'm not sure how you break that. And I like the notion of politicians on both sides sort of saying we can agree on this, but I'm not even sure that that's enough. I kind of feel like people who matter to the people who are recalcitrant on the mask side. So, whether it's celebrities who haven't been wearing masks, or just people who speak those, a governor who has been opposed who now starts to wear a mask. I mean, I think that kind of example might be more helpful, frankly, than, the fact that I saw a picture in your paper, I think, Apoorva, today of Joe Biden wearing two masks. He had an N95 and a cloth mask on top of it. That's not going to change the views of people in some of the red states who feel like they're being loyal to President Trump by not wearing a mask. There's got to be another way found to get to that, I think.
Well, along those lines, what are some other misinformations, misconceptions about the pandemic that you think are still out there? This question is from Kate Yandel, and she wants to know, what kind of service journalism should science writers be doing to combat that?
Well, I think one of the things that is still not particularly well understood, a couple of things. There are so many manifestations of this disease, and they don't all hit people who are 75 and older, or people who have diabetes, or people who are obese. You know, there are plenty of young, obviously they're not the majority, but there are plenty of young people who have had this and feel ill for months and are wondering whether or not they're ever going to feel better again. There are kids who get that condition, Miss C. I mean, it is absolutely true that 99% of the people who get this or more are going to be fine and we're going to survive. But a lot of them are going to have, a lot is probably an exaggeration, but a number of them are going to have sequelae that are going to last for a while that they don't need to go through. You know, we should not feel like this is nothing. We, you know, I don't think we've done a very good job of explaining to people that this is, it has ramifications regardless of your age, and should be avoided if possible. The other thing I struggle with is every time somebody says to me on Twitter, you know, oh, well, the case fatality rate is only X, or, you know, the infection fatality rate is only 0.6. It's like, do you know what that means? Like, I mean, that means like, I might get this wrong, which would be really embarrassing, but that I think that means like 6 out of 1,000 people that you know could die. I mean, like, that's crazy. Like, for people to have dismissed when it looked like the CFR was 1% or 2%, for people to dismiss that as, oh, well, it's not such a big deal. It's a huge deal. It means all of us would know multiple people who die from this. Why don't we try to avoid it? I have been startled by the, oh, it's just kind of attitude. I don't know.
I think one of the things I think that plays into that is the dashboard approach that we have to this, where you've got cases, hospitalizations, and deaths. So, you know, you get it, you either get really sick and you're hospitalized, or you get better. If you're hospitalized, you either get better or you die. And those are the groups. And your point, we still know so little about this disease, but the things that we know are pretty scary. And you know, the recognition right now of the mental health consequences of this, some that's disease related and some that's related to the fact that, you know, we have to social isolate and distance and people's lives are disrupted. But I think that there's a lot that can still be written and needs to be written about the disparities in access to care, to mental health services, you know, disparate impact on the mental health side based on income and the color of your skin. You know, and that can tie in to some very important policy discussions around you know, why don't we have universal health care? Why don't we treat mental health services on a par with physical health services? These are things, you know, where there's always been and continues to be stigma around mental health. Well, you know, the COVID situation is going to be a mental health catastrophe. You know, there was a flurry of stories yesterday about mental health in veterans and increased rates of suicide, and you know, but it's kind of a little blip niche story because it was Veterans Day. But there's a lot, I think, that can be tied in there, and tied in. You know, I love some of the solutions journalism that looks at these problems and then is saying, okay, and the solutions that we're seeing for this are this. You know, it doesn't have to be. We don't have to accept this as the norm going forward.
Apoorva, why don't you answer that question?
Well, I was going to say that the Times just did a story today. One of my colleagues did a story about mental health issues in kids and teens, that anxiety and depression, especially in teenagers, is just really skyrocketing. So there are a lot of long-term consequences that we haven't even fully begun to figure out. But I was going to say earlier too, Helen, when you were talking about the CFR, that something really odd has happened in this pandemic, right? I think in March and in April, when the numbers were actually much lower, we were all freaking out at the idea of anybody dying or getting sick. And now we have all of these people dead, all of these cases, and people have just seemed to reach a point where they're not even really accepting the reality of what's happening. And it's like we've just become numb to this level of death and illness and this really altered reality. But I also want to ask a question that Emiliano Rodriguez had asked, was very related to this, which is, as a journalist covering COVID, talking to folks on the front line, you feel like people are not paying attention to the pandemic. How do you deal with that frustration?
I rage, at my colleagues. I actually, I have a few science journalists that I've known for a long time, and they live, they don't live here. We live in a bunch of different cities over a bunch of different time zones, and we sort of reach out to each other every once in a while and say, therapy session, and we say, okay, book a room, and we go into Zoom and try to support our mental health. But I don't think that's what your questioner was asking about. But it's been a very challenging year as a reporter. I mean, I'm always cognizant of the fact that I'm employed, I'm being paid, I'm healthy, I can work from home. As 2020 goes, I'm definitely one of the lucky ones, but it has been a very tough year.
Rich, do you have anything to add to that?
No, I mean, I'm not a working journalist, but I think it's so important to practice self-care, and it can be really traumatizing covering these kinds of events, especially for a long period of time. And this is not something. Pandemics are marathons, and if you have to act every day like it's a sprint, the mental health consequences for people doing that are I think going to be real.
Yeah. I mean, we might all be very tired, right? Very soon. So along those lines.
Already there. I don't know. And I don't understand how you're managing, because you're churning out stories. It's amazing.
I'm on a sprint every day.
Yeah.
This is a question from Dan Diamond. I don't know if it's the Dan Diamond, but the press has aggressively, it sounds like him, but the press has aggressively covered the Trump administration's response to COVID-19. Do you think the press will be equally aggressive under Biden? And do you think the Democrats who eagerly championed investigations of Trump's CDC will understand probes into Biden's health department? Helen?
I think that the press has been really responsible in its pursuit of the current administration's lack of activity on this front. And I think it's hard to imagine that reporters who have been asking really tough questions for 4 years now are going to stop asking tough questions. It's not really the nature of our profession to do that. I think, I hope there are somewhat fewer tough questions to ask. I mean, if the new administration bases its response on science, there goes a whole line of questioning that will fall off the table, because we're not going to be talking about injecting bleach anymore, or trying to use sunlight entering the body somehow as a therapy. And if the administration decides to toss messaging of this back to the CDC, then, that will also change the dynamic some. The second part of the question is, I guess I would think about the second part of the question, will reporters go after the CDC under the new administration? I guess I think we'll have to see how the CDC evolves, going forward. Is it going to go back to something more like what it was? Is it forever changed? I don't know. I think people will be watching very closely. And I expect that if, the CDC were to have a few major missteps in the way that they did early in the pandemic, then they'll get as lambasted just as hard, I would think. But I don't know.
I was going to say, actually, Helen, that I think we'll be asking even more questions because we'll be better rested, and we'll be honing our skills and asking all the tough questions. We'll have had more sleep. We'll be, more on top of our game and not always exhausted.
We should ask Dan if what he's suggesting is that everybody's going to go easy on the new administration. I can't imagine he will be.
The question triggers two things for me. One is, when I was at ABC, I would go down to CDC to talk to leaders about the importance of engaging media, because if you look back across administrations, there tends to be a pattern of early on pretty good access to CDC, and then something happens and it gets all shut down. And every media request then that comes into CDC has to be cleared in Washington at HHS or sometimes at the White House, and reporters get mad, we have no access, and CDC scientists get mad that reporters don't understand what they're doing and are trashing the agency. And so I would expect early on that there's going to be increased access to CDC and more interviews, and then at some point something's going to happen and they're going to say, all right, we need to centralize the messaging, and it'll get you. I mean, that would be my prediction. The other side of it is, though, that when I would talk to folks at CDC about the importance of engaging with the media, they would say, yeah, we really need to partner with the media around these messages. It's so important. And I would say, the media, they're not your partner. Yeah. They're not your partner. And almost every time I would do one of these talks, that phrase would come up. We need to partner with the media. It's like, no, that's not the role of the media. Early on in a crisis, the media will tend to give you some slack and will amplify your messages, but then we'll very quickly dive into interrogating those messages and say, like, well, why? Why are you saying to do that? And that's when the relationship sometimes gets a little testy, and there's this desire then to control the message in a really intentional way. So I hope that media does not go easy on the next administration. That would be a disservice. Right.
Can I just add that, at the beginning, this is true with every time there's a change in an administration. Initially, the problem that arises is not of your doing. And so they get a bit of slack. But 6 months from now, if there aren't enough N95s, that's not going to be President Trump's problem. That's going to be Joe Biden's problem. And we will ask those questions. And it might not even take 6 months. But, my point is, they can't expect to be, surfing off of the fact that, oh, we're better than the last guys. That'll last for a little bit. And then, we'll do what we do. Journalists do that.
Right.
Because there are a lot of young journalists on the call. I do want to also go back to Rich's point about at some point the access shuts down, and note that this is not the first time, or really at all, that the CDC has been closed to journalists. I mean, we haven't had easy access to CDC people for 20 years, I want to say. NIH, CDC, it all changed a long time ago. And I mean, you get some access, but it is not just the Trump administration that has shut down access to things.
No, I mean, the Obama administration was not great on openness at all. But, I would say that I've
We had
never.
talked to MMWR authors. That was different.
Yeah, okay.
We probably have time for just one last question. This question's been asked a couple of times, so I want to make sure I get to it. And I think it's kind of forward-looking, asking about the Biden administration again, so it's a good place to stop. The Biden administration named science experts to its task force, but no communication experts. So it brings us right to the beginning of where we started. I worry about the difficulty of translating science into words that influence behavior for the safety of our populace. I don't see public health authorities succeeding consistently or getting better responses further along into our pandemic. What would each of you recommend for the task force in terms of communication? And is there a person you would name to the force for the sake of communications?
Well, yeah, I think what I would say is it's not exactly clear the role of the task force at this point. In 70 days, it will be the government that is responsible for the response. And so hopefully identifying within government who the spokesperson will be for public health on this. Helen and I have both talked about Ann Shokett's gifts in that area. We'll have to see who's the new director of CDC, and hopefully it will be someone who has abilities to communicate. You'd hope as well that whoever's Surgeon General, whoever's head of HHS, that they're taking into account in those roles the real importance of having people who can speak clearly about things that can be quite complex. And not everybody's got that, and it's you can get better at it, but not everybody's can do that really well. And there are a number of people at CDC who have that ability and those skills, and so putting them into those roles will be really important.
Yeah, I would agree. People always confuse what we do with communications. I'm often asked how I would, advise people about crafting a message. And it's like, I'm not the crafter of messages. I'm the person who takes them in and analyzes them and reports on them or challenges them. But I don't feel like I've got any particular skill in knowing how public health messages ought to be crafted. So I don't think I have an answer there, but I do think it's really important for people to understand something that Rich mentioned earlier. We're not on their team. Sometimes what we do is helpful to them, but we are not on their team. And, if they don't understand that, they're riding towards a world of hurt at some point in time. And I was on a panel. Dan's back here, so I think I need to close this up. But I was on a panel at a CDC conference about a year and a half ago with somebody at CDC who I won't name, but who is like really high up in communications. And I said that during my presentation. You guys need to understand, I am not on your team. And she came up to me afterwards and she's like, why did you say that? It's like, because it's the truth, You might like some of the stories that I write, but you're not going to like all of the stories that I write. And I, you need to understand that.
I think that's a really important point. And it's never been more obvious in science journalism than during this pandemic, when we've been asking very tough questions of all of the organizations that normally we might take a little bit more at face value. I do want to mention, though, that apparently they're not the COVID task force. I spoke to one of them today, and they wanted me to know very clearly that they are the advisory board to the Biden administration and not a task force, because they don't want to be confused with the Pence White House coronavirus task force. So, but also I would say, I think in their defense, even though I'm not their partner, as Helen said, there are a lot of people on that board that are very, who are all very good at communicating science and COVID science in particular, Michael Westerholm and Celine Gounder and Zeke Emanuel. I mean, they may not be communications experts, but they're certainly very articulate and they know how to get the message across.
Yeah, it's a strong group.
That's true. Yeah.
You know, what I take comfort in, really, in addition to just the, you know, their obvious commitment to aggressive steps on public health, is really how experienced they are. I mean, this is like the Ron Klain factor as chief of staff. There may be people who sort of assume that, well, you know, the press will go easy on a Democratic administration, but people like Ron Klain with that kind of experience know how completely wrong that is. And it's really important to sort of set everybody's expectations, you know, so nobody thinks, what, we thought you were gonna, you know, go easy on us, and it's not going to play out that way, and it's really important that everybody understand that. Wow, this was really a wonderful discussion, and it flew by. I think Rich and Helen and Apoorva were worried about boring people, but there was nothing boring about this. The time absolutely flew. But these three work so hard that they really, I think we taxed them to the max here, and that we should let them get a glass of wine and turn off the cable news and watch some junky TV for an hour and then fall asleep, or, you know, whatever's on the agenda. We're going to do this again next week, same time, start time 6:30, same place, Zoom, of course. I'll be talking about something completely different, which is the search for life outside of Earth. Speaking of microbes. So it should be fascinating. And if you're interested in participating, just go to journalism.nyu.edu/KC. And that is also the place, by the way, where you will see a video of our discussion this evening, posted probably sometime tomorrow. So thank you all very much. I see that our crowd stayed with us the whole time, so I think they were as fascinated as I was. Thank you, Helen. Thank you, Rich. Thank you, Apoorva. That was really great.
Thanks very much.
Thanks very much
Thanks
for
for
having
inviting me. Really enjoyable.
Bye-bye.
Bye-bye.